So this is Group Five's presentation against animal testing, presented by Omar Marvia and Lila Tabakovic. History of animal testing, Omar Marvia. So humans have used animals for testing since essentially the dawn of medicine. In ancient Greece, people started dissecting animals for anatomical studies in place of humans due to social taboos and barriers that were established at the time. Galen of Pergamon was a Roman physician who pioneered the techniques for dissection and vivisection of animals. Vivisection essentially refers to the practice of performing operations on live animals for the purpose of experimentation or research. The use of animals in medical research increased during the Renaissance period and the Age of Enlightenment as well. René Descartes was a philosopher born in 1596 who described animals as machine-like, which paved the way for scientists to essentially justify what is now considered gruesome experiments on animals. Baruch Spinoza, born in 1632, was also a philosopher who claimed that we as humans could use animals as we please, treating them in a way that best suits us, for their nature is not like ours. Many other philosophers, such as René Descartes and Baruch Spinoza, believed that animals were only for the benefit of humans. Ethical aspects, Omar Maravilla. So animal testing has brought up concerns regarding animal welfare in research and experiments conducted by scientists today. This has posed the question if it is really ethical to keep an animal confined and constantly subject to procedures that cause them consistent pain and stress. The effectiveness of animal research for human benefit has also been questioned, posing the question, if research shows that experiments fail time and time again, why keep animals going through the stress that these procedures can, impose on the animals themselves? Cultural importance, Omar Maravilla. So the rise of social media has seen an increase in anti-animal testing movements. Essentially, individuals can spread their message with just a click of a button. If you go on Twitter or Instagram or whatever social media platform, chances are you will come across accounts and people who advocate against animal testing, and they use these platforms to essentially spread their message out there, so other individuals can see and interact with them, or possibly even join their movement. Groups such as PETA have given rise to spreading awareness and shedding light on the realities of animal testing as well. Animal rights and welfare has become such a controversial topic in the modern United States. It's constantly brought up in different laws, different protests, different meetings amongst activist groups. The rise of this attention has led to questions on the legitimacy of scientific testing done on animals as well. Some alternative methods of research that have been proposed in place of the ones currently established in medicine are the use of human volunteers, different computerized methods, and also animal use as well, but with non-violent methods of scientific investigations. Current events regarding animal testing, Omar Maravilla. So more than 115 million animals are used for biomedical experience, or just to supply the biomedical industry in general. These animals include mice, primates, rabbits, birds, cats, dogs, and a variety of other species. In the United States alone, about 1 million animals are kept in laboratories, which again include mice, rats, birds, different species of reptiles, and agricultural animals as well. And this can include cattle, sheep, and goats, most notably. In Canada, 69 million animals were used for experiments, and over 115,000 animals experienced severe pain above pain tolerance, according to PETA. In the United Kingdom, 76 million animals are used for experimental research as well. In 2020, the NIH budgeted nearly $42 billion for research and development, and these research experiments used live animals to conduct their studies, most notably to see responses to different vaccines, see how different illnesses infected organisms, such as a study that was conducted at Johns Hopkins University, which used barn owls, which were conducted in 2022 and are still believed to be going on the campus as well. The purpose of these studies were to aim to gain a better understanding of human autism and schizophrenia as well. And unfortunately, these experiments did result in a lot of pain implemented on the owls, such as implanting rods into their skulls and cramping their wings so they couldn't move, just so the experiment could be done in an effective manner, if you will. Their eyes were also forced open to be exposed to light and sounds for 12 hours. And the purpose of this apparently is for the scientists to be able to track or measure their brain responses to these uncomfortable predicaments that they would place the owls in. In regards to for or against animal testing, I think it's important to know that, there are a lot of inhumane aspects when it comes to animal testing, such as unnecessary pain methods that are implemented on the animals, different experiments that go against the comfort of an animal. I think it's important to note that if there are other methods that can be done, perhaps they should, such as voluntary human trials. I think it's more effective for scientists and medical researchers in general to use humans to study human-related diseases in place of animals which have different physiological anatomy as well as internal anatomy. So I think it's important to keep in mind that there are methods out there that can prove more effective than using animals for the benefit of human research. Effectiveness of Animal Testing by Omar Maravilla. So to elaborate on the effectiveness of animal testing itself, as mentioned previously, humans and animals have drastically different physiological anatomies. Animal models are typically used to test against human diseases and other medical complications. Examples of this being spinal cord injuries, viruses, and cancers. To emphasize on spinal cord injuries, the problem with testing animals against these specific injuries is that animals have differences in neurophysiology, anatomy, and behavior, which ultimately makes it hard to correlate with humans. In a 2013 study in which mice were used for the study of inflammatory disease, it was found that mice differ from humans in regards to their response to the treatment, and this is likely attributed to genetics, according to the study. Even some mice differed from one another, with one of the medical researchers saying they ultimately concluded that their study supported higher priority to focus on more complex human conditions rather than relying on mouse models to study human inflammatory disease.
So, I'm going to talk about the other part of against animal testing, and it's going to be the influence of laboratory procedures and environments on experimental results. When it comes to animals being in these like types of environment, usually sometimes they're up in cages, sometimes they're in these windowless rooms for most of their life with no looking on the outside world. I've also added three examples here, two of rats and one of monkeys, where their chlorostone chlorostone levels end up rising in monkeys when they are watching other monkeys being restrained for blood collection. Blood pressure and heart rates skyrocket in rats when they are watching other rats being decapitated. Stressed rats develop chronic inflammatory conditions and intestinal leakage. When it comes to the typical levels in laboratories, they can damage blood vessels in animals and sometimes even in the flooring in which animals are being tested in. Sometimes there's spinal cord injury, there are experiments that are able to affect if a drug shows its benefits or not. The sociological importance, research has shown that, and there has been a association between animal cruelty and subsequent antisocial behavior, including interpersonal violence between childhood and adulthood. Within and outside families, there are usually little effects when it comes to witnessing animal cruelty or having a companion that was actually abused. Drugs and procedures may be effective in humans, but they tend to not be developed because they tend to fail in animal studies. Here I have added a quote from Vanderbilt University Medical Center where the phenotypes that are studied in animals are not truly identical to humans, to human disease, but are limited representations of them. And in most cases, animal studies do not assess the role of naturally occurring va- variation and its effects on the phenotypes. It's important because humans tend to be harmed because of the fact that there are misleading of these animal testings. Um, the misleading of the results in these animal testings in these certain experiments. When it comes to non-animal methods, non-animal methods tend to perform better than animal studies because when they're combining chemistry and cell-based alternative method, it actually shows that about 85% of the time, human reactions actually go up. Methods that are being used on human skin actually go up to 86%, tends to be accurate. Testing on animals when finding out of chemicals and drugs if it harms babies can only detect about 60% of its dangerous substance. But when it comes to non-animal testing, and using it on human stem cells, it has about a 93 detection substances that are known to cause developmental problems. Or yeah, but developmental problems. When testing on live mines for selfish toxins, there were once cruel and unrelatable. It was actually sworn be shown that when they replaced by a superior, like another chemical method, it's actually ensuring that there is a better protection against selfish poisoning when protecting humans. So, in the end, with all this gathered, I feel like animals should have the right to sit there and be able to live their life just as any other animal should, getting the love and care that they deserve. It's understandable that even though they're sometimes animals can be the same as us in certain levels, I still think that there's an understanding point where animals are never as humans, so any procedure on them, there's never like a right outcome for us. So I feel like it should be banned over the understanding that it's unreliable on certain medications, even though it works effectively on animals, it doesn't work on us because again, you are testing on animals but not testing on actual human. So the whatever you're testing on works on animals and not on us. There are other alternatives as well that are available, which we don't need to keep looking to animal testing and hurting these poor animals. We can easily keep them alive and find something else for scientists to work on. I feel like this is also the main thing where it comes to like animal testing, that because you are testing on an animal, you are going to understand that this works better for the animal and not the human. So because of the fact that, again, you're testing on this animal, we can test it on a completely like different human or completely like other thing, and it's not gonna work on us because you already learned the methods of working on an animal. Thank you.